include our registered medical technologies who are responsible for the RNA extraction. So thank you very much. That's all.
Thank you very much, Dr. Saloma. So it's clear that among the samples that were tested between November to December, we have not detected the UK variant nor the South African variant. But this does not mean that we should let our guards down. And in view of that, may we call on Dr. John Wong just to give us some overview, no? Ano bang impact nitong itong UK variant sa transmissibility or sa R0? Dr. John Wong.
Thank you, Laura. May I share my screen?
Yes, po, go ahead.
Can you see my screen?
Yes, po, Doc.
Okay. So it's good that we still have not detected the variant here in the Philippines, no? So it will buy us some time, no? So if the variant becomes the dominant species, meaning it becomes 100% of the species in the Philippines, no? This is what we can expect, no? This is the baseline, no? Normally at our current R of 1.1, no? 20,000 cases at the beginning of the month will be about 32,000 cases, no? By the end of the month, no? But if the variant takes over, you know, the 20,000 cases can become almost 300,000 cases, no, by the end of the month. No? So this is what we want to avoid. No? And although the variant does not cause more severe disease, no, just having more cases means you'll also have more absolute number of deaths. No? So instead of 74 cases, no, with the current R, no, we would get about 700 deaths, no, if the variant again becomes dominant. So we still have some time, no, to prepare, no. So how do we prevent exposure and infection, no? How do we prevent accumulation of active cases? So we do this by reducing R, no, or reducing the number of persons that one case will infect, no. There are three things that we can do, no, that the public can do to reduce this, no. First is to reduce the transmission rate, no. So actually, when we say that the variant has a higher transmissibility, this is what goes up, no, transmission rate, no. But we can bring it back down, no, by having universal masking and wearing of face shields, no. So universal means we need everyone, 100% of the population to be doing this, no. And then we should continue cough and hand hygiene, no. Second is contact rate, no. This is the rate at which people come in contact with each other, no, and thus transmit the virus, no. So this we avoid by avoiding crowding or settings, no, where there is crowding, and if this cannot be avoided, no, improving indoor ventilation. Finally, no, the last thing that the public can do is to reduce the duration of infectiousness, no. So that means when you feel something, no, COVID-related symptom, no, you consult right away, no, so that in case it is COVID, no, you can be tested and isolated right away, no. We have to remember that COVID patients are infectious 2 days before they're symptomatic, no. So by the time you're symptomatic, you might already be exposing your family, your friends, or your coworkers, no. So early consultation, no, is important. Thank you.
Thank you po, Dr. Wong. So those are very clear messages. And I guess from what we've learned from Dr. Saloma and Dr. John Wong, the measures are still the same. But we'd like to hear from our experts, no? Maybe from Dr. Ana Ong, name first.
I'm still muted, Laura. Ayan, okay. Magandang hapon po sa ating lahat. I think despite the good news that was shared by Dr. Saloma regarding the sequencing results of the samples that have been detected so far, siguro kailangan nating maintindihan na natural talaga sa mga virus ang magkaroon ng variation. Ito ang isang paraan na ginagamit ng virus para makasiguro na kayanin niyang kumalat throughout the human population. So it's just a matter of time na magkaroon ng iba pang variant, whether ma-pick up natin itong UK variant sa ating mga bumabalik na travelers, or maaring magkaroon din tayo ng sarili nating variant, no? And importanteng maiwasan natin sana yung paglitaw ng mga ganitong klaseng variant dahil as explained by Dr. Wong, kung magkaroon man ng variant na mas mabilis kumalat or mas nakakahawa, magiging malaking problema siya kasi tataas na naman ang ating healthcare utilization, magkakaroon naman ng malaking impact sa ating rates ng mga nagpa-positive. And of course, importante ring isipin yung kanyang magiging impact sa ekonomiya kasi syempre gusto rin naman nating mapayagan na ang karamihan ng ating mga kababayan na bumalik na sa trabaho, makabalik na sa pag-aaral, and all of these other activities that we used to have prior to COVID. So siguro yung take-home message coming from all of this new information will be the same, no? Baka naman kasi pagsawaan na ng ating mga kababayan pakinggan yung inuulit-ulit natin, pero ito pa rin talaga ang kailangang gawin. Yung ating minimum public health standards, making sure na ang ating ventilation is adequate, we're always wearing our mask and shields, we are always applying physical distancing and being watchful about time na yung ating apat dapat para maiwasan natin ang pagkakahawa. So if you'll allow me also, Laura, idudugtong ko na rin dito yung tungkol sa parating na ating mass gathering event, yung traslasyon. And I think this is a very good example kung saan natin pwedeng isabuhay ulit yung principles ng apat dapat, no? So, syempre, kung maaari sanang hindi na dumalo, diretso doon sa venue, mas maganda kasi hindi naman natin maiiwasan na magkumpul-kumpul ang mga tao. Kasi alam naman natin this is a very important event for our Catholic population, and dati nga nung walang COVID, diba nga, matindi ang paghahanda nito. So ngayon na meron na tayong COVID, baka pwedeng isipin ng ating mga deboto kung paano nila isasabuhay ang kanilang pananampalataya without having to go to the venue itself, no? Pero kung maiisip po nilang pumunta, wag pong kalilimutan yung mga principles na aking shinare ngayon lang para makaiwas po tayo sa pagkakahawa. Lalo na't ngayon sinusubaybayan na nga natin itong mga bagong variant na mas lalo pang mabilis na maikalat. Salamat.
Thank you po, Dr. Ana. Baka pwede rin po tayong makarinig ng mensahe mula kay Dr. Eva ng UPNIH.
Maraming salamat, Laura. Mensahe po namin galing sa UP National Institutes of Health, kahit na po hindi na-detect ang UK variant sa mga samples na na-sequence po namin sa UP Philippine Genome Center, hindi po ito panahon para mag-relax. Sasabihin ko uli yung sinabi po ni Dr. Laura, no? We should not let our guards down. Kailangan po tayo patuloy na maging vigilant at gamitin ang ating talino at kakayahan upang wag na pong tumaas ang mga kaso ng COVID sa ating bansa. At kami po ay nakikiisa sa sinabi na rin po ni Dr. Ana Ong tungkol sa darating na translasyon at gumamit ng ating ang ating ilagay na isa puso natin na marami pong paraan para po ipakita ang ating pananampalataya. Hindi po natin kailangang mag-mass gathering. Maraming salamat po.
Salamat po, Dr. Eva. Si Dr. Isa po, Alejandria.
Okay. Thank you, Laura. Magandang hapon po sa inyong lahat. What I'd like to say siguro is, yes, it's good news that we do not have the UK variant or yung variant of concern. And based dun sa presentation ni Dr. Saloma, what we can say is that the dominant variant still in our country is the D614G, no? So yan pa rin yung nagsisirculate sa atin, no? Which is, if you remember, yun yung nag-cause nung surge nung June, July, August, no? So sa ngayon, yun pa rin yung dominant strain natin. And kahit na may variant, pareho pa rin yung mode of transmission ng COVID-19. Hindi nagbago ang pag-transmit nito. It's through respiratory droplets, no? Pag umubo or suminga, no? Kaya pareho pa rin ang dapat nating gawin na pag-prevent, no? Yung mga tinatawag nating precautionary measures or minimum public health standards dahil pareho pa rin naman ang pag-transmit nito. So same, dapat mag-face mask, tamang pagsuot ng face mask at face shield. And then yung distancing. So nabanggit nga, this is not yet the time for us to relax. Hindi pa rin recommended ang mass gatherings kasi sa mass gatherings doon mas malaki ang tsansa na makakuha tayo ng infeksyon, no? So ang isa pa ring importante, no, yung virus gaya na ng nabanggit na ni Dr. Ana, we expect that the viruses will continue to mutate, no? We can expect these variants to happen. Actually, marami ng mutations na nangyari dito sa SARS-CoV-2 virus natin. It's just that hindi lahat ng mga mutation na yan ay may significant effect, no? So wala siyang naging epekto sa transmission, sa signs and symptoms. Pareho pa rin ang signs and symptoms. Ito lang D614G, tsaka itong UK variant, nakita natin na mas mabilis ang pag-transmit. Again, pareho pa rin ang precautionary measures. Therefore, as mentioned by Dr. Jan, dapat natin panatiliing mababa ang ating infection rates, no? Pag mas mababa ang infection, ang chances din ng mutation ay less, mababa din. So, maganda yung nakikita natin, sana panatiliin nating mababa ang ating infection rate sa pamamagitan ng pagsunod sa mga public health standards. Magkonsulta kaagad pag may naramdaman, mag-self-isolate para hindi natin maikalat sa ating mga kasambahay ang infeksyon. Yun lang po. Maraming salamat.
Thank you, Dr. Isa. Words from Dr. Wong. Or si Dr. Edsel na lang. Ayan, Dr. Wong.
Well, sorry. So I think it's important that we realize na this can become very serious or very dangerous if the variant becomes the dominant strain, no? But we should also remember na it's within our power, no, to control this, no, but through our own behavior, no. So there's something we can do about it, and we should do it for our sake and the sake of our family and friends and co-workers. Thank you.
Thank you po. Director Celia, you have anything to add po?
Yes, I will just add some inputs on the value of sequencing that is being done. Maybe sequencing as the method itself is new to many of us. And just to drive home the importance of this method, it just determines the composition and order of the building blocks of the genetic material of an organism. So the whole genetic material of the organism is characterized using by identifying the building blocks called nucleic acids and the order in which they appear. So basically, yun lang po.
Then the mutations occur when there are changes in this chronologic position of the nucleic acids. Now going to, I think we need to understand that sequencing has been done in many countries, especially the developed world. And it has contributed a lot to improvement in public health measures. For example, because we knew the sequence of this SARS-CoV-2 virus, the diagnostic tests for the virus were developed on the basis of the sequences. The therapeutic modalities were also based on the sequences, and even the vaccines developed were also based on the sequences. So it is quite important that biosurveillance or genomic surveillance should be pursued because a lot of the public health control and prevention measures are based on evidence from these sequence results. Sequencing will benefit the population more than the individual. So on the basis of that, the DOH has already released operational guidelines on how the public can help refer isolates for potential sequencing. And aside from the travelers, it was mentioned in the guidelines that COVID-infected persons who were reinfected or chronically infected or who were given some treatments which failed, such as plasma transfusion, are potential patients whose samples need to be sequenced. And in terms of the vaccination campaign, there needs to be a system in place to monitor whether the vaccine's effectivity is maintained at a high level. Because if these variants appear, there may be some risks that the vaccines may fail in the future. So there needs to be some available information on the sequences from patients who fail vaccination. The other important public health measures would be identifying people with epidemiologic link to persons who in the future are identified to have these mutant strains of COVID. So in the future situation when a mutant strain is identified from a patient, the epidemiologic link to that person should be identified, and the sample from the links should be sequenced as well. And also, we need to refer patients with treatment failures, with patients who possibly are non-responsive to other modalities of treatment. And then the laboratories should be able to refer the samples in a timely fashion, transport the samples to the sequencing facilities so that they can be processed right away and we can detect any emerging mutants in a timely fashion for timely intervention. Thank you.
Thank you po, Director Celia. Dr. Saloma.
Gusto ko lang po ipaalam sa lahat that this genomic biosurveillance na ating ginagawa together with our partner institutions, RITM and NIH, ay tuloy-tuloy po. So we have some guidelines that have been placed, mga protocols kung paano magpadala, sino magpadala. So gawin po natin ito sa buong taon. Sinusuportahan po naman tayo ng DOS, TPC, HRD, as well as the DOH para ipagpaigi pa natin yung ating genomic biosurveillance. At sa mga tao pong interesado, ngayon po nagmura na siya. Dati kasi yung mga March, April, and May, mahal pa talaga siya. Ngayon, nagmura na rin po yung sequencing pag marami kang gagawin. So pag sabay-sabay mo siyang gagawin, kasing mahal lang po siya ng RT-PCR test. Yun lang po.
Thank you. Very good news po yun. No? But before we go through our Q&A, Dr. Edsel, do you have something to add po?
Doc, you're on mute.
Sorry, it wasn't allowing me to unmute. Sorry, I was late. Yeah, so I think that everyone's already said their piece about these variants. These variants are not new. Again, you know, just going back to June, na sobrang nag-surge talaga tayo. That was B614G. And yun nga, of course, it was hard work talaga, pero nakayanan naman natin. And now that we're detecting these kinds of variants, although hindi pa naman confirmed, because we don't even know if the one that was detected in Hong Kong really came from the Philippines or doon na lang siya nahawa. We need a little bit more detail. But for me, I did see that one of the quick questions about are we late in this? You know, this variant was detected in the UK December 1, and they were sequencing October and November samples. It really takes about 2 weeks to sequence. And so, hindi instant kasi ang sequencing, as Dr. Saloma will tell you, and it also needs to be analyzed. So, kailangan talaga yung meron na talagang in place na sequence rather than yun nga, because of the nature of the delay of the sequencing. And that's what we're really trying to do right now. I think the more important action point talaga is kaya may variant or wala, alam natin kasi kahit yung original virus naman, nagsa-search talaga yun nakita naman natin, is that we are ready to prevent these kinds of surges, that we double down on our preventive measures. And whether the variant is here or not, that we recognize the need to continue these until we get the vaccines. Because hindi lang naman talaga tayo naghihirap kumuha ng vaccines. Even Japan has said they're not gonna start vaccinating until February. We hope that that's our timeline also, but you know, there's really a rush for all these vaccines. So basically, all I'm saying is these variants are not new. We know how to deal with them. We need to get better at making sure that we are able to detect the entrance of these variants. But the bottom line is we are trying to save lives by preventing surges. And we know how to do that, but the genomic surveillance will help us preempt these even more. Over.
Thank you, Dr. Edsel. Now we go to the Q&A part. At ito na po, no, I'll ask this to you, Sec. Vergere, bulk of questions po regarding po doon sa Hong Kong resident that who tested positive for the UK variant. Ma'am, may updates po ba dito, and what are the measures or ano na po yung mga ginagawa ng Philippine government o ng DOH to address this? You said.
Yes, thank you, Laura. Actually, we learned of this last night. Around 9 p.m. or 10 p.m. And we immediately started coordinating, trying to contact the IHR focal point person of Hong Kong through our IHR system also. Unfortunately, we have not been receiving the response. So what we did this morning was to call the WHO country office, and they committed to help us. But of course, we were really in a hurry, or we wanted immediate answers. So we called on the Western Pacific Regional Office, and through this, they were able to give us a contact number, a direct line that we can call the Ministry of Health of the Hong Kong government. So we are now trying to call directly so that we can get further details. But in parallel, what we did was to, last night, we already requested from the Bureau of Quarantine the flight manifest of this PR300, the flight that was identified. And we received it this morning. We were able to look at the line list of passengers. There was a total of 40 passengers in that flight. And based from the profile that we have right now existing, na currently nahawak natin, a 30-year-old female. And we still don't know the nationality because even in the press conference of the Hong Kong authorities, hindi nila naman sinabi na Pilipino talaga. They just said that it came from Manila. So the line list of passengers, we have 40. We were able to zero in on 2 individuals with a profile of 30 years old female. So may dalawa tayo, and we were able to get the contact address, the contact numbers and all. Unfortunately, both contact numbers cannot be, hindi na po sila sumasagot, patay ang telepono. So ito pong contact address ay tinatawagan na ho natin ang mga pamilya. Also, aside from these 2 individuals, we also are doing contact tracing na rin dito sa additional 38. So we have 40. We just zeroed in initially dun sa dalawa, and now the other 38 passengers, nagko-contact trace na rin po kami dito. Kinuha na namin lahat ng contacts and addresses so that we can be able to do this. We already were able to inform our regional offices as well as to these different individuals na kasama dito sa PR300. So yun lang po ang may bibigay natin sa ngayon. We will be informing the public, no, and of course our partners in media kung meron na ho tayong makuha ng complete details coming from the government ng Hong Kong. Laura?
Thank you, Yusek. Meron lang po ditong question siguro kay Dr. Saloma. If because of our strengthened genomic surveillance, are we going to be testing more samples now just to check if this variant has indeed reached the Philippine shores?
In coordination po ng ating mga ports at saka mga resus, nais po sana namin na magbabatch sampling or magbabatch sequencing in batches of 768 more or less because that will turn out to be cheaper individually at saka isang processing na lang. Kaya sa yung mga nakapasok sa criteria for the biosurveillance, makipag-ugnay po sila sa ating mga resus for the transport of the materials dito sa Philippine Genome Center at saka ang ating DOH naman po ay nagpalabas naman ng mga guidelines. So expect po ninyo na mas marami pa tayong gagawin.
Thank you po, Dr. Saloma. So we're just checking kung ano pa po yung mga remaining questions considering comprehensive na yung nabanggit na update, no?
Laura, can I answer Bon's Mangsambol sa chat box?
Go ahead po.
Oo, because the Philippine Airlines daw was saying that the individual who tested positive sa Hong Kong had a negative result prior to departure. Yes, we have that information, Bonds. Itong dalawang sinasabi natin na nag-zero in tayo, na dalawang may profile na 30 years old female, were both tested prior to their departure, no, to Hong Kong. One was tested on December 20, the other one was tested on December 22, and both had negative results. Laura?
Thank you, Yusek. Okay, I'll ask the question of Greg Gregorio po. It has been said that the UK variant is 70% more transmissible than the original strain of SARS-CoV-2 variant. But have we identified also the difference between the UK variant and the dominant D614G in the country, which could have led to the 15-fold increase in our cases? If this new variant will this new variant affect out our COVID situation?
So Laura, let me answer that. Okay.
Yes,
so gusto ko lang po ipaalam sa ating tagapakinig na yung UK variant already contains the D614G. So in addition to the D614G, nagkaroon pa siya ng iba pang mga mutations, at least 17 mutations, 8 of which occurred at the spike region. At ang binabantayan palagi dito sa UK variant, yung region po na N501Y. So sinasabi din nila na syempre dominant na nga yung 614G, pero na nagdadagan pa siya ng mga mutations, naging mas malakas pa ang kanyang transmissibility. Yun lang.
Thank you, Dr. Saloma. Maybe I'll ask this to Dr. Edsel. Christine Sabilio po is asking if it's possible ba na sa Hong Kong na nakuha ng passenger yung UK variant or the COVID itself?
Naka-mute si Dr. Edsel.
All right, thank you.
Sorry.
Right. Yeah. So, I mean, first of all, before I answer that, yung sinabi ni Dr. Saloma, I agree with that, except that we're also still not sure if the other mutations add or if this is really just a tinatawag nilang epidemiologic phenomenon, meaning nagkaroon lang ng cluster, so mukha siyang mas transmissible. But we have to understand na meron na, as Dr. Saloma said, may D614G na yan. So it can only just go up from there if these mutations are proven to cause more transmissibility. And then as to whether nakuha niya sa Hong Kong, it really depends on the timing. Kasi ganito lang yan eh. Kung may negative siyang test noong December 22, it takes usually 3 to 5 days before you become positive again. So if nakuha niya yan sa Hong Kong and nag-test siya sa Hong Kong after December 27, then it's more likely na doon niya nakuha yon, because we know that there are already cases of the UK variant in Hong Kong. We don't know. We need all this data. Otherwise, it's all just speculation. Kasi it might be just na, okay, nag-positive siya sa Hong Kong. Maybe they tested her in January. Pero because relevant yung travel history, nasama yung sa Philippines. And again, going back to that issue, nangyari rin yan dati, yung sa Taiwan, di ba? Na hindi natin alam kung doon nag-incubate or dito. It's going to be very difficult to tease that out. But the bottom line is, the action point is, we probably should at least act like there is a possibility it is here, so that we take double care talaga, so that we don't have a spike. Over.
Thank you. Yusek, okay. Yusek, there's a question from Raul Denzel. No, following up on Pal's disclosure, some reports say she tested positive only on the second week of her quarantine after her second swab test. If that's the case, what does that mean?
Well, maybe we can again ask our experts, no? Dr. Isa, Dr. Ana, and the rest, Dr. Edsel.
Sige po. Dr. Ana?
Naka-mute, Laura. Please allow her to.
Okay, sige. So that's why it's important actually to get the details that the DOH team has been requesting from the Hong Kong government. Kasi yung timing, kung kailan ginawa yung test, and under what circumstances will be the one to help us piece together kung saan malamang nakuha nitong traveler yung infection. Kasi alam naman natin na ang PCR, meron niyang various levels of sensitivity depending on the time frame kung saan kinukuha or kung kailan ginagawa yung test. So lahat ng information na yon kailangan hawak muna natin bago natin mabigyan ng mas magandang conclusion kung saan kaya nahawa itong traveler na ito. So sa ngayon parang mahirap tayong mag-speculate kasi we don't have the complete information to put together. Thank you.
Okay, so yung last question na po, no, nasagot na po yun. I guess yung main point po dito is keep practicing minimum public health standards, and then we're still getting information po so that we can give a more definitive answer to your questions. With that, I'd like to ask Yusek Berhere to wrap up na po our special presser. Yusek?
Yes, bago po tayo magtapos, gusto lang natin ulit magpasalamat sa ating mga experts who have continuously guided and supported the Department of Health. This set of experts are part of the task force for the COVID-19 variant, which was created by the Interagency Task Force for Emerging and Re-emerging Diseases. So thank you po, Dr. Cynthia Saloma, Dr. John Wong, Dr. Eva Marie Cotionco de la Paz, Dr. Marisa Alejandria, Dr. Ana Ong Lim, Dr. Edsel Salvania, and of course, our very own Director Celia Carlos. Gusto lang namin ipaalala uli sa inyo lahat. Unang-una, ang Department of Health po, together with all of our partners, is working with the Hong Kong authorities para ma-identify po natin at makumpleto natin ang detalye regarding this Hong Kong passenger. And we definitely would need this additional information as what our experts have mentioned para po makumpleto natin kung ano man pong klaseng analysis ang maaari nating magawa. Kailangan din po natin malaman, and we'd like to inform you that all travelers going out of the country to Hong Kong are tested prior to their departure. That is a policy of the country of destination. So kung ang destination country po ay sinasabi na magte-test po yung mga taong umaalis po dito sa ating bansa. And that is what these people who went to Hong Kong did. No? Nakita na ho namin sa COVID kaya ang mga resulta ng mga passengers po nakasama dito sa PR300. While we have not detected the variant yet, kailangan po natin maintindihan na hindi po tayo pwede mag-relax katulad po ng ating mga experts na sinabi, no? Sinabi ng mga eksperto, hindi tayo pwede maging complacent. Ito pong tinest ng Philippine Genome Center, unang batch pa lang po yan ng mga pumasok dito sa ating bansa. And marami pa hong parating, no? Dahil hindi naman po natin isasara totally ang ating borders. So we do not want for our public na maging complacent. Kailangan tuloy-tuloy pa rin po ang ating pagpoprotekta sa ating sarili at sa ating pamilya through our minimum public health standards. And what Dr. Cynthia has mentioned, we are supporting this surveillance that will be done through this mga genomic sequencing. Tayo pa ay sumusuporta dyan at gagawin na po natin yan. That is why we have this kind of group already. And as what the President have said and even our IATF officials, this will not just be confined with this variant that we are looking at right now. Pagtutuloy-tuloy po itong ganitong klase ng surveillance para mas magkaroon po tayo ng headway dito po sa mga ginagawa nating response dito po sa ating bansa. So we will be continuing to update the public on this new variant, especially na meron na ho tayo ngayong task force kasama ng ating mga eksperto. Gusto lang ho namin ulit ipaalala sa lahat that we cannot be complacent at this point. Let us continue to do our minimum public health standards. Umiwas muna po tayo doon sa matataong lugar. Gawin po natin yung apat dapat, no? Iklian lang natin ang panahon that we interact with other people. Let's wear our face mask and face shield ng maayos. Atin po tayo umiwas sa mass gathering. As I've said, kailangan po well-ventilated yung mga pinupuntahan natin. And I think for now, the most critical also aside from our non-pharmaceutical interventions is alamin po natin ang tamang impormasyon. Kailangan po lahat tayo tama ang impormasyon na hawak natin para alam natin kung paano tayo aakto. Let us refrain from spreading this wrong information para po hindi nagkakagulo ang ating mga publiko. So sana po makatulong natin ang media partners with this. We have given you the information and we hope that you can help us spread the word so that people won't panic because of this situation. Maraming salamat po sa inyong lahat.
Maraming salamat po.
Thank you.
Thank you po.
Thank you po.
Thank you.
Thank you.